Good afternoon, everyone. We'll just start after few minutes because we are still waiting for the participant to join. So let us just wait for some few minutes more and then we'll start with the event. Yes, we wait for the participant to join the session. I would just like to walk through today's rule that please none of the participants please do not unmute your mic and do not on the camera. If you have any question, you may just type it down in the chat box, because after the session only there will be an opening for question hours. So please, I request every one of you not to unmute the mic or not to on the camera. And I welcome each and every one of you. And it is really good to see from all over the India, from all different parts of the India that we have joined here today. And thank you for joining. It's a warm welcome. I warmly welcome you guys. I hope everyone is visible with my screen, right?
இப்பதான் தெரியுது ஏன்னா ஆடியோ கனெக்ட் ஆகலையா, அதான் நீங்க இருக்கீங்களே உங்கள்ட்ட கேட்கலாம் அப்படின்னு தான் கேட்டேன். ஸ்ரீனிவாசன் ரங்கநாதன் போட்டு வாட்ஸ்அப்ல ஒரு பையன் ஒண்ணு. ரைட் ரைட் ரைட், அதனாலதான் உங்களுக்கு போன் பண்ண. ஓகே ஓகே, மறந்துட்டேன் ராம்நாத். அதான் என்னடா படிக்கும்போது வித்தியாசமா இருக்கேன்னு யோசிச்சேன். கிளம்பிட்டு வீட்டுக்கு போறீங்களாங்க சார்? ஓகேங்க சார், பேசுறேன் சார் அப்புறமா. பாய் சார்.
update Screen share.
Okay, our speaker is here, so soon she will be starting with the presentation. Yes, we all know that you have seen the brochure, every one of us, right? So, ma'am is Dr. Rima Rasotra. She is an assistant professor in physiotherapy department, Lovely Professional University. So, she have years of experience, and she will be sharing the screen. So, may I please start the presentation.
All right. A very good afternoon to one and all present here. Myself, Dr. Rima Rasotra, Assistant Professor from Department of Physiotherapy. I would like to give my sincere gratitude thanks to Dr. Monica Gulati, the Executive Dean of our department, and Dr. Suresh Mani, the head of the school of our department, for giving me this wonderful opportunity to speak on the topic of the importance of pelvic floor examination among the females. So, first of all, let me share a small story with you, like why I got interested in the pelvic floor, we can say, examination and dealing with the women health. So while I was working in my Ministry of Defense, during that time, I realized one thing, that many of the females, they are having the underlying hidden conditions, pathological conditions, many different type of conditions which are not present in the, we can say, about which we are not aware. Many of the females still they are not aware about what all problems they are having. So that time I just expose this thing, and I come in contact with a number of females who were really having the pelvic floor problems, and most of them, they were having the hypotonus, we can say, pelvic floor, in which there was the weakness of the pelvic floor muscles. So during that time, it came into my mind that it is a very good topic, as well as this is going to be a wonderful, we can say, in the future also, it is going to be very, very helpful for the women if we are going to make the people educated about this, what all conditions they are going to, what all problems they are having due to pelvic floor, and how they can come up with the examination of that. Clear? So today we will be discussing about the importance of pelvic floor examination among the females. So basically,
7
so
7
अच्छी password
join password क्या देना है
617779
I would like to request all the delegates to please mute your mic. If you have any queries, you can type your questions. It will be, I will be answering all the things after I'm over with the session. Okay, so it's my humble request to everyone. Please don't interrupt in between. Okay, so let's again, starting with the importance of the pelvic floor examination among females. So let me first of all tell you that I'm not going to cover up all the anatomical parts, because Most of you people are aware about what all muscles are there and all. So we will just come up with the overview of the muscles, and I will put my full importance on telling you and explaining you how we can come up with the examination, how we can come up with the self-examination also. And if you are certified in pelvic floor as a physiotherapist, if you are certified in that thing, how you will come up with the examination during that time also. Okay, so both the methods I will explain you. And for the PT management, which is because after the evaluation we have to come up with some we can say treatment also. So that treatment, we are hoping that we are going to organize the next webinar, and in that we will take all the rehabilitation part concerned with the pelvic floor problems. Clear? So first of all, the objective of this lecture is to study the role of various muscles involved in the pelvic floor, female pelvic floor. And the second is to learn the various different techniques of the pelvic floor evaluation. So these are the two basic objectives. Hopefully, all of you will be able to learn after we are done with the session. So here I'm sharing a beautiful one image of a male and the female pelvic floor muscles. So first image is of a male pelvic floor, and the second image is of a female pelvic floor. In this you can see all the muscles are very beautifully, they are being we can say differentiated with the different colors to make you people know about what all muscles are there and what are the three layers which are being involved in the pelvic floor. So coming up with the overview, first of all, as every one of you know, that pelvic floor, it is a dome-shaped muscular sheet separating the pelvic cavity above from the perineal region below. So this cavity encloses the pelvic viscera, bladder, intestine, and the uterus. So pelvis is a dome-shaped muscular, we can say, sheet. Okay, it is protecting the all the pelvic content inside. So what are the main functions of the pelvic floor muscles? So basically coming up with the main functions, first of all, the pelvic floor muscles okay, let me share with you this model. So we are having this a pelvic model, and inside we are having all the pelvic floor muscles. And here we are having the pelvic contents. So the main function of these pelvic floor muscles are, first of all, it provides the support to the abdominal contents. Okay, all the GIT contents are being supported with the pelvic floor muscles, and all the pelvic viscera are also being supported with the help of the pelvic floor muscles. Second is, the second main function of pelvic floor muscles are, it maintains the continency of the urine and the feces. Third is, it allows the voiding, defecation, sexual activity, and the childbirth. So the third point is very important, because pelvic floor muscles, if they are weak, if they are damaged, the person may have the problem in voiding, in micturition, in performing their sexual activities, and the most important, the childbirth. So the introduction about the pelvic floor. Your pelvic floor muscles help stabilize your core while assisting with essential bodily functions like pooping, peeing, and having the sex. Like I just discussed, that these pelvic floor muscles are very much important. I again request all the delegates, please mute yourself, and by the end of the session, you can ask your queries. All right. So like I just explained you, the pelvic floor muscles, they help to stabilize the abdominal core muscles also, and they are providing a very good assistance whenever the person is coming up with the defecation process, the person is coming up with the micturition, or the person is coming up with some sexual activity. So they can weaken over time due to injuries and even the normal aging process, leading to conditions like the incontinence or the pelvic organ prolapse. So if we talk about the pelvic floor muscles with the age, because with aging, degeneration of the bones, muscles, everything is going to take place. So with age, there will be the degeneration of the pelvic floor muscles, due to which it may lead to the weakness of the muscles, leading to the, we can say, urinary continence and some pelvic organ prolapse also. Exercising your pelvic floor muscles can combat the negative effects of having weak pelvic floor muscles. So if a person is having the weak pelvic floor muscles and we just tell the person to come up with some exercises, they are going to be very much fruitful for the person. Okay, because if the muscles are weak and we are going to teach them some of the strengthening exercises manually, or we are going to give some of the strengthening treatment to the person, both are going to be very much beneficial to the person. So What are the pelvic floor muscles? So we generally know the pelvic floor, it consists of the muscles and the connective tissues that support the important organs in your pelvis, like the bladder, bowel, and the internal reproductive organs. Your pelvic floor muscles hold those organs in place while also providing the flexibility to assist with the bodily function like peeing, popping, and the sex. Along with other key muscle groups in your torso or core, your pelvic floor muscles allow your body to absorb outside pressure in a way that protects your spine and the organs. At the same time, these muscles help you control your bowel and the bladder functioning also. So these muscles are very much helpful because most of the time we do some activities which increases the intra-abdominal pressure, like we do sneezing, we do coughing. So all these are going to put a lot of pressure on the pelvic floor muscles, which can lead to some of the consequences in the future. So pelvic floor muscles, they support the bladder, urethra, vagina, uterus, and they help in performing the bladder and bowel activities also. They squeeze and relax so that you can control when you pee, pop, and pass the gas. Help with blood flow and vaginal contractions during sex and organism. Support the vaginal delivery during the childbirth. So these are some of the main important functions of the pelvic floor. Now coming up with a very important part, how you can feel your pelvic floor muscles by squeezing the three openings. As we know, if we talk about the pelvic floor, we have the three openings. Okay, let me show you a model. We have the three openings. We have the vaginal opening, then we have the urethral opening, and we have the anus. Okay, and it is very important that before teaching the person some of the, we can say, a treatment protocol, or when you are some we can say dealing with some problem, how you are going to feel all those things. So first of all, if you want to palpate and feel the vaginal opening, simply you can do one thing. You can sanitize your hand. Okay, you can lubricate your hand with some ultrasonic gel or with some we can say lubricating gel, and then you can insert. First of all, you have to be in crook line position, and then you can insert your finger, one finger or two fingers inside the vagina, and then try to squeeze them. Okay, so when you are trying to squeeze them, you will be able to feel the contractions, and you will be feeling that pelvis is moving inward and upward. So through that you will be able to feel the vaginal opening. Second is urethra. How you are going to come up with the feeling and palpation of the urethra. Imagine that you are peeing and squeeze as you are, if you are stopping the flow of the midstream. So if while passing out the micturition, if in between passing the micturition you try to control that, you try to squeeze that, then you can feel the presence of the urethra and the underlying muscles involved with that. Third is anus. In this, you can squeeze your anus as if you are preventing yourself from breaking the vein. So you can just assume that like you are passing out the air, foul air, and while passing the foul air, you are going to squeeze your anus. Okay, so there you can feel that palpation also, and you can feel again the palpation which is going to be in an inward direction and upward direction. Okay, so this is how you can feel your anus. So in each case, you should feel muscles which are inside your pelvis, which are being pulled inward and upward. So these are your pelvic floor muscles. They are contracting. When we are contracting these openings, okay, when we are squeezing these opening, the muscles are also getting automatically contracted and relaxed. So this is one of the best way when you can feel the contraction of the pelvic floor muscles. Now, what are the important, again, the most important functions of pelvic floor muscles? They are going to support us, they are going to provide the proper stabilization, they are going to control the sphincter activities, and they are going to be helpful during the sexual activities. Now, a small brief, we can say, discussion about the pelvic floor muscles. So we generally know that pelvic floor muscles, they are divided into three layers: layer 1, layer 2, and layer 3. So in layer 1, we have a urogenital triangle in which we have the four muscles. We have bulbocavernous, we have ischio-cavernous, we have superficial transverse perineal, and we have the external anal sphincter. So let me show you through this diagram. From here it will be clear. All right, so here in this image, yes, from this image you can see the presence of the bulbospongious muscle. Okay, Then we have the external anal sphincter. We have the ischio-cavernous muscles, and here we have the transverse muscles also lying in the first layer of the pelvic floor. Okay, next we have the second layer, that is urogenital diaphragm. In this we will be talking about the urethral sphincters, compressors, sphincter urethral, vaginalis, deep transverse perineals, and the perineal membranes. So this was the second layer. Third layer, we have the most important muscles, with, that is the levator ani muscle, levator ani muscles, and we can have the further distribution of levator ani muscle through the pubococcygeal muscle, vaginalis, puboanalis, and puborectalis muscle. Then we have coccygeal, piriformis, obturatus internus, and the other muscles. So here is a diagram. We can just view this diagram, just coming up with all the layers of the pelvic floor. Now the coming up to the most important part, the assessment part of the pelvic floor. Okay, because whenever we are talking about the assessment of the pelvic floor, we will be most of the time assessing the perineal region and the vaginal region. Okay, so first of all, whenever we have to come up with the assessment and the examination of the pelvic floor, first of all, we always concentrate on taking the assessment of the patient, and that assessment has to be subjective, in which Thaiba ma'am, could you please look after this? Dr. Thaiba ma'am?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
I'll be removing those participants who have unmuted your mic now.
All right. So coming up with a subjective assessment. So whenever we are going to come up with the evaluation, we can say of the pelvic floor, we generally concentrate first of all on taking the assessment. So assessment always has to be through the demographic profile. So first of all, we always concentrate on coming up with the demographic profile of the person, taking the name, age, gender, and the occupation of the person. Then the most important thing come taking the history part. Okay, so we have to concentrate on taking the present history of the person, past history, medical history, and then we have to, it is very important that we have to yes, we have to take into consideration the history related to the childbirth, urine leakage, perineal injuries, surgeries, sexual activity, any type of pelvic organ prolapse. So we have to take all these parameters into consideration before coming up with any type of evaluation. Then any other history which is related to chronic low back, especially which is not responding to the treatment. Okay, so if a person, because many times it happens whenever as a physio we are examining the person with the low back pain, and when we start taking the we can say history of the patient, we come to know that the female, she is suffering from uterine prolapse. Okay, so the underlying reason for that back pain is the uterine prolapse, due to which it has lead towards the back pain. So we can correlate the things related to all the conditions. Then coming up with the objective assessment. In objective assessment, we will come up with the observation part. In observation, we can view the, first of all, the general observation of the person, and then we will focus upon coming up with the perineal observation also, because it is very important before coming up with the evaluation as well as the treatment, that we have to observe the perineal region of the female. Okay, then comes the posture. In posture, we will assess the posture because posture will be assessed through interior view, lateral view, and through the posterior view. And we know that many times it has been founded that many females who are having lordosis, okay, and again that lordosis main reason is due to uterine prolapse. Okay, so we are going to correlate the things again. So if there is any type of postural abnormality, in that case also we can correlate the things, and we can come up with the exact diagnosis, that what is the main reason, what is the main condition which is going to cause that particular problem to the person. Then coming up with the gait analysis. So when a person observation, general observation, we are going to observe posture, then we will be looking after how the person they are walking. Okay, so gait is very important, because let me share a condition with you. The females who are having grade 3 and grade 4 of uterine prolapse, in that what is happening, uterus is coming out of the vagina. Okay, and in some cases we can see it will be like a ball shape. So when the females are walking, they will be walking while keeping both the legs abducted, because whenever they will be walking, that uterus which is out from the vagina, that is going to rub and cause the frictional injuries and the skin injuries to the person. Okay, so most of the females, those who have grade 3 and grade 4 uterine prolapse, they will be walking with the abduction of the legs. Now the most important part, before coming up with the exact invasive, we can say intravaginal examination, we have to come up with the perineal observation also. Okay, so perineal observation can be further divided into static as well as the dynamic observation. So the static observation, statically what we are going to do is we are going to make the person lie down on a couch, and we will tell the female to come up with a crook lying position, and we are going to keep the legs into abduction, and then we are going to observe the perineal of the female. Okay, we are going to observe the skin, then we are going to observe any type of symmetrical and asymmetry in the structures, then we are going to just see is there any scar formation, any type of edema, redness. Okay, many times female they come up with the episiotomy also. So I think all of you might be knowing what is episiotomy. It is a minor surgical incision which is being given during the time of normal delivery if the head of the fetus is enlarged. Okay, and the birth canal is not getting widen up to that level. So to come up with the easy passage of the birth, we can say easy passage of the fetus from the birth canal, doctors perform a minor surgery, episiotomy. Okay, so we can rule out that also whether there is any scar or any episiotomy being done over the perineal region or not. Then we will be checking for any type of bulge or any type of drop in the perineal region also. Then this was about the static observation which we are going to observe, okay, while exposing the perineal region of the female. And now coming up with the dynamic observation. In dynamic observation, we will first of all check the contraction and relaxation of the pelvic floor muscles. How we are going to check the contraction and relaxation? We will tell the female to perform some activities like just perform the cuffing. So whenever she is going to perform the cuffing, we will be able to see that there is contraction of the muscles happening and relaxation of the muscles also. Along with that, we can tell the female to take a deep inspiration, deep expiration, and we can tell her to perform some exercises also. Through that, we will be able to just observe the dynamic activity of the muscles. Next is the movement of the clitoris and perineal bodies. So this also, when we will give some particular task to the female to perform, we will be able to see the movement of the clitoris also and perineal body also, and anal rings also. So normally anal rings, whenever the female is performing any type of activity, there is a presence of the wrinkles around the anal region known as anal rings. Then observation of the pelvic floor muscles during cuffing. So when the female is going to perform the cuffing, so we are going to observe all the pelvic floor muscles. After coming up with the observation part, we need to put a lot of importance on the sensory examination also. Okay, because many times it can happen due to some abuse, we can say sexual abuse or some injury over the perineal region. There can be some sensory impairments also. So it is very important before coming up with the invasive, we can say this examination and the treatment process, we have to come up with the sensory examination also. So in this, we have to check the sensation with the cotton bud over the labia majora, menoria, and the vestibular area. So in this, what we will do, we will be having the perineal region. Okay, we will be having, you can assume it as a stick having the cotton, and then we can just palpate around the we can say perineal region, and we can just check all the sensations on the interior side, on the we can say superior side, on the inferior side, on the lateral sides, and over the perineal region also. So by this we will be able to come up with the conclusion whether the sensory examination of the female is normal or not. Now coming to the most important part, the pelvic floor examination. Okay, so we generally use two methods for the pelvic floor examination. One is the direct method and the other one is the indirect method. In direct method, we will be directly checking the examination of the pelvic floor muscles, and that could be done through four methods. One is the PVMMT, that is per vaginal manual muscle testing. Okay, and the second one is through the pereniometer or the EMG. Third one is through the vaginal gauge.
This meeting is being recorded.
And fourth one is through the ultrasound. So these are the four direct methods which we generally come up with the pelvic floor examination. And there are two indirect methods also which we generally use, that is a cuff test or the stress test, and the other one is the pad test. So before coming up with the pelvic floor examination, whether we are performing the direct or the indirect method, it is very, very important that we have to teach all the methods to the patient very correctly, so that there is no any type of further consequences with the wrong methodology used by the patient. So wrong strain can worsen the condition. Okay, for example, we are telling the person to cuff and the person is cuffing so strongly, so it can put some of the forces over the pelvic muscles, which can lead to some of the injuries or the damage. So it is very important before coming up with the evaluation, because in evaluation the patient participation is very, very important. So we need a full cooperation of the patient, then only we will be able to come up with the particular evaluation. So that's why we generally put so much importance to the correct methodology taught to the patient and used during the evaluation. So now this is the position of the patient while examining. Generally, if the examination is being done in, we can say, some hospitals by the gynecologist or in some clinics, we generally use the lithotomy position. So you can see this diagram. In lithotomy position, the female is in a supine line position, legs are abducted and they are being supported with some instrument. Okay, so this is a lithotomy position which makes the procedure very easy. And if we are not having this type of couch or this type of instrument with us, we can use the simple method of the crook position, which will be very helpful in conducting the evaluation of the pelvic floor. So this is a modified Oxford grading used for the per vaginal MMT. So before this, let me explain you one thing, the evaluation method. So this is very important. So we generally have two types of evaluations for the pelvic floor. Okay, so that is a vaginal examination. So we have two methods. One is the self-examination and the other one is the transvaginal examination. In self-examination, we are going to we can say teach the full process to the patient, and the patient himself, sorry, herself is going to perform this we can say procedure, because sometimes some we can say patients, they are very, very insecure and they don't have confidence on others, so they better like to perform all the things themselves only. Okay, they have a self confidence in doing those activities. So to those patients, if they don't allow us to come up with the transvaginal examination, then we can teach them the self examination also. So for self examination, we can guide the female that she can be in a supine line position, having the crook position, using the crook line position, and we can tell her to wash the hand before the examination. She can sanitize the hand and she can lubricate the finger with the help of the ultrasonic gel, and then she can insert one finger inside the vagina and she will be able to feel the things inside. Okay, and if she is able to if one finger is able to be taken inside, she can just come up with the second finger also to rule out the full examination of the pelvic floor. Okay, so she will be able to feel out whether her pelvic floor muscles are very much relaxed, they are very much contracted, or any type of resistance is being felt during the time of self examination. And second method is the transvaginal examination. Generally the transvaginal examination, the other one was also the transvaginal method only, but that was the self examination which is being done by the we can say patient herself only. But this method, the other method, could be used by the therapist or the female who is being certified in pelvic floor. And in this method, again the position of the patient will be crook line. The therapist, she will be again sanitizing the hand, she will be wearing the gloves, lubricating the hands. Okay, and then she's going to insert one finger inside the vagina. Okay, if one finger easily can move inside, we can target the two fingers also going inside the we can say vaginal region, and we will be after the we can say after we have inserted two fingers, we will give certain tasks to the females to perform, like perform cuffing, perform the contraction of the pelvic floor, perform the contraction of the vagina, try to relax that. So through those activities, we will be able to judge what type of muscles the female is having, whether she is having the hypotonus muscles, whether she is having the hypertonus muscle. Okay, so what category of muscle she is having, we will be able to judge through the examination. So we generally use this modified Oxford grading for per vaginal MMT. So we have 5 grades for that. Grade 0, 1, 2, 3, 4, 5. So grade 0 is when we have inserted the finger, we tell the patient to contract the muscles, but she is not able to contract. Okay, so there is no contraction felt. So that will be grade 0. Grade 1 will be a very weak pelvic floor contraction. So it will be like a flickering contraction of the muscles. So that you are going to tell to the female that please try to contract the muscle. She is not putting that much effort, but you can feel that minor contraction of the muscles has taken place. Grade 2 will be a very weak pelvic floor muscle contraction will be there. Grade 3 will be a moderate in which we can feel that yes, she has done a mild contraction and relaxation. Grade 4 will be when there will be a good pelvic floor muscle contraction, and grade 5 will be when there will be strong pelvic floor muscle contraction. So according to the we can say if, depending upon the evaluation what type of feedback we are getting, based upon that we can grade the muscles of the pelvic floor. Next, coming up with the indication of transvaginal assessment. That means why we generally perform this transvaginal assessment. First is if the female is having vaginal laxity. That means vaginal laxity is the muscles are very weak. Her vaginal muscles are not that much strong to hold and do certain activities. Mostly it is being identified when the female is going for the mating activities with the male partner. The vagina is not that much strong to hold the penis of the male inside strongly. Okay, so a man will be feeling that there is a slippage of the penis again and again, so there will be stabilization problem in that. Next is continency. So we can have the females who have urinary incontinence problem, pelvic pain, prolapse if there is a history of sexual dysfunction, vaginismus, sexual abuse, and severe pelvic pain. So in all those conditions we can perform the transvaginal assessment. So before moving ahead, let me just take 2 minutes to explain you one condition known as vaginismus. Okay, because most of you I think will not be aware about this condition, and this is one of the condition which is very new, prevalent in the society. So vaginismus is one of the condition in which the female is involuntarily contracting her pelvic floor muscles. Okay, she's not voluntarily but involuntarily she's making her pelvic floor muscles very very tighten up, due to which she is not able to come up with a sexual activity with the partner. So this is also one of the main reason why most of the females nowadays they are having infertility problem, because they are not having the proper mating process. Because whenever they are coming up with the mating process, she will try to involuntary, her muscles may become very very tight, so it is going to be leading to unhealthy sex, and which can be one of the reason for the infertility also. So the main reason of vaginismus can be if female has some prior injury to the pelvic floor muscles, if the female she has some type of sexual abuse, child abuse, or some like maybe she's having prior, she has listened someone having a bad experience of the sexual life, so due to that she's not she's having the phobia related to the sexual activities. So all these could be some of the reasons which could be there for the vaginismus. So these are some of the indications of the transvaginal assessment. Now, in what all conditions we are not supposed to give the transvaginal assessment? If there is an absence of the patient's written consent, like I explained you, many times female don't allow us to come up with the examination. Okay, so if the females they are not willing, that means they will not be having the full confidence, and they will be coming up with some wrong methodology or some other we can say techniques will not be to that level. So if there is an absence of the patient's consent, we are not supposed to use this method. Next is 6 weeks postpartum and post surgery. So after some type of surgery or after the delivery, we have to wait for at least 3 months, and after 3 months we can come up with the invasive transvaginal examination. Then if a female has severe vaginitis and infection, she's having menstrual cycle, if she is pregnant, so in all those conditions we are not supposed to come up with the this examination part. Now coming to the head MMT assessment. So let me tell you, nowadays we are generally using this maneuver for the assessment of the pelvic floor. So this has been given by the head. Desai. He's the founder of the, we can say, WOW Institute. So he has just come up with this assessment, and nowadays we generally use this assessment, we can say this grading system, whenever we are evaluating the female for the pelvic floor. Okay, so for this we have six to seven grades. Zero is the baseline tone when we are not going to feel anything normal. Then we have 1, 2, and 3, and we have -1, -2, and -3 also. In one, in this, what we are going to do is no grip, finger easily slide out, clearly palpable contraction, at least 5-second hold. So in this, we will tell the female, for example, she's lying down and we are going to insert one finger inside. We will tell her to contract the pelvic floor muscles, okay, to contract the perineal region. She's not able to do that. Okay, and the finger is also getting slided out. Okay, so in that case, we are not able to feel any type of grip. Okay, so in that case we are going to give a grade of 1. Second is grade 2, somewhat grip on examiner fingers, don't finger does not finger pull in and pull and in, and at least 5-second hold. So for grade 2, when we are putting the finger, a mild, we can say, grip we are able to feel, but that grip is not strong enough. So in that case we can give a grade of 2, that indicates that the grip is weak. Next is third grade. In third grade, we can just, whenever we tell the female to contract, she is contracting it very nicely and we can feel a strong grip. So in that case, we will give a grade of 3. Next is we are going to give a grade of -1 if there is over tight spasmodic pelvic floor muscles, inability to relax. So in this case, we are inserting the finger inside the vagina of the female. We will tell her to relax, so that we can come up with a further evaluation, or we can take the finger out, but she is not able to relax. Her muscles have become very spasmodic. So this is being graded as -1. Next is -2. This is moderately tight pelvic floor muscles. So in this, it is not very, very tight, but yes, we can feel more than the normal strength of the grip. So that is moderate tight pelvic floor muscles. And in the third one, there is complete relax. In this, when we tell the female to relax or contract, she is not able to come up with the contraction, but there will be complete relaxation of the, we can say, muscle. So in that case, we are going to give a grade of -3. So we generally follow this evaluation method nowadays to evaluate the pelvic floor muscles of the female. So these are the instruments: pereniometer, which measures the strength of the perineum, the muscles of the pelvic floor muscles. Nowadays, a number of pereniometers, different types of pereniometers are available in the market. Like I have shared the 3 images. First is the Kegel pereniometer. With the Kegel pereniometer, along with the checking the pereniometer strength of the pelvic floor muscles, we can guide the female to perform the Kegel exercise also. So with that also, we will be able to check the feedback. Next is pereniometer with feedback. So pereniometer and feedback is there, we can check that. Next is pelvic floor exercise, muscle exerciser and pereniometer, in which we have inserted the pereniometer, and we are going to check when the female is going to do the pelvic floor exercises. Along while she is performing the exercise, we will be checking the strength of the muscles with the help of pereniometer. Next is vaginal cones. So I think again, most of you might not be aware about this. Vaginal cones are the small silicone devices. Okay, they are being constructed in a shape of penis, you can see. And sometimes to do the evaluation, we are using these cones also. Okay, so for what we used to do, we used to sanitize these cones. Okay, then we used to again lubricate it with the help of some ultrasonic gel or with some lubricating oil, and then we try to insert it inside. So nowadays what we are doing, we tell the female only, the patient only, that try to insert it inside. And when they are inserting it inside, we are telling them to perform certain activities. Like for example, the female has inserted the vaginal cone inside, and when she has inserted the cone inside, we will tell her to do cuffing for 5 to 10 minutes. Okay, or just come up with a sneezing. Okay, for 2 to 3 times. Okay, artificial sneezing. So when she's performing those activities, we will check whether that vaginal core will be stable inside the vagina, or it is trying to get slipped out. Because it generally happens, those who have the weak pelvic floor muscles, in those cases the vaginal cone is going to come out. But in those cases, some cases in which the pelvic floor muscles are very strong, the vaginal cord will be inside only. Okay, so we can teach, we can tell the person to perform the activities in three positions. One is supine position. Same activities we can tell the female to perform in sitting also, and same activities we can tell the female to perform in standing position also. In standing, again, when she's standing, she's having the vaginal core, we will tell her to perform cuffing activities, laughing activities, which will increase the intra-abdominal pressure. And if we feel like the cones are being well fixed inside the we can say perineal region, then in that case we can come up with some advanced we can say these more activities also, like we can tell the female to do squatting for 5 to 10 minutes. Okay, so if again the vaginal core is stabilized, that indicates the pelvic floor muscles are very very strong. If it is getting slipped out, or half of the vaginal cone is inside and half is outside, so in that case we can term it as the muscles are weak. So this is also one of the evaluation method which is most commonly used nowadays. And the last one is the ultrasonic method. This is a transvaginal, because most of you might be knowing we generally perform the ultrasound by two methods. One is transabdominal, that is above the ultra abdomen. We use the probe and we check. And the second method is the transvaginal method, in which through the vagina probe is being inserted to rule out the underlying problems. Clear? So this method is generally used by the radiologist doctors only. Okay, so this all were the direct methods. Now coming up with the indirect method. In indirect method, we will come up with a cuff test. So a medical professional observes leakage ranging from few drops to whole urine while patient cuffs or does activities which increases intra-abdominal pressure. The sign of leakage is observed in the cuff test or the stress test. So in this, we will tell the person to cuff. Okay, and during the cuff we will check whether there is any type of leakage of the urine or not. So this is about the cuff test. The next comes very important, the pad test. Okay, so in this pad test, what we are generally doing is, first of all, we will have one sanitary pad and we will weight that pad. Okay, what is the weight of that sanitary napkin? We will weight that. And while we have to perform this test, we will give 500 ml of distilled water to the patient. She is going to drink that and she is going to relax for 15 minutes or half an hour, and then after 15 minutes we will tell her to perform some activities for 30 minutes, like you have to climb up the stairs, you have to descend the stairs, then she has to perform some activities like sit to stand for 10 times, she have to perform the cuffing. Okay, so these activities we will tell her, and after these activities we will come up with the testing of the pad. So in after these activities we are going to take out the sanitary napkin and we are going to check the weight of that sanitary napkin. Okay, and if there is an increase of 1 gram of the weight, that is being considered normal, because female, she will have the perineal discharge also and sweating also. But if the weight is more than 1 gram, in that case we can consider that she is having some type of incontinence or some other pathologies. So this is about the pad test. So this is all about the evaluation of the pelvic floor muscle. And like I discussed with you in the start of the lecture, that rehabilitation part we will be covered in the next lecture. And along with that, I would like to share, I have published one article in the newspaper in Punjabi Jagbani, which indicates औरतां विच होने वाला बार-बार गर्भपात. That means recurrent miscarriage among the, we can say, among the females. And in this, I have highlighted and put importance that we can say pelvic floor muscles are also one of the main reason for the recurrent miscarriage, because if weak pelvic floor muscles are there, so it is going to lead towards a recurrent miscarriage also. So, and lastly, this is my Facebook page, pelvic floor rehab specialist, and this page has been created for the public, for the society. The females who have any type of pelvic problems, they can approach to me, and people are putting their we can say messages over here, and I generally try to message them by evening. Whatever problem they are having, sometimes they try to discuss with me, and sometimes they give me a call also, and we have a healthy discussion on what is the main problem for the we can say the symptoms what she's complaining about. Clear? So that's all from my side. Thank you. Hello, Thaiba ma'am, Dr. Thaiba.
Natasha, ma'am, please explain how we can determine whether it's hypertonic or hypotonic.
All right, ma'am. In some conditions, when we generally come up with the examination, we tell the female to contract the muscles and relax. Side by side, she is able to contract and relax. That indicates she is having the normal musculature. Okay. But when we tell her to contract, she's not able to contract, and we can feel the muscles are very relaxed. We can't feel any type of contraction. In that case, we can consider it as a hypotonus, we can say muscles. And hyper is when we tell her to relax, she's not able to relax, and the grip is very, very strong. So that could be the hypertonus, we can say muscles, or the hypertonus pelvic floor muscle condition.
Okay, thank you so much, ma'am. I hope Latasha, it's clear.
Yes, ma'am.
He's asking for the Ashi chef is asking for the assessment performer. If you can share them.
Okay, ma'am, you can take the email ID of the candidate. I will share the assessment performer with her. No issues.
Sure, sure. Okay, there is one more question, ma'am. I would like to just read it out. If there is chronic vaginismus, is possible to examine pelvic floor?
If there is a chronic vaginismus, in that condition, yes, we can come up with the evaluation, but we first of all have to take the patient under full confidence. We have to give certain treatments to the patient. We can give the cryotherapy over the vaginal region, so that there will be anesthetic effect over the muscles. And when we do the examination of the, we can say, pelvic floor, the candidate is not going to have any type of pain or discomfort. So yes, we can examine the chronic vaginismus condition also.
Okay, thank you so much, ma'am. Ma'am, there is multiple students, they have shared the email ID. Then I think it's better that you share me the performer, and then I can forward them all. I think
All
most
right,
of
no
them want
issues.
the.
I will be sharing my this PPT with you. So, and 2-3 more performers are there. I will be sharing with Dr. Thaiba ma'am, and she's having the email ID of all of you. So she will be passing to all of you. No issues with that.
Thank you so much, ma'am. I think the question hour is over now, so we will just end. Okay, ma'am, one last question from Surya. How to relax pelvic floor in dyspareunia? How to treat it? What will be the PT management, I guess?
Sorry, ma'am, I didn't got your question.
Ma'am, how to relax pelvic floor in dyspareunia?
Dyspareunia. How to
Yeah.
relax? Okay. So
Yes,
for
yes.
relaxing, you can first. Okay. How? All right. So for relaxing, you can first of all take the help of the electrotherapy modalities. You can use the cryotherapy. You can perform the ultrasound. You can come up with the TENS application also over the perineal region, superficial, not the invasive one. And this is going to relax the muscles to large extent. And then we can perform the, we can say, invasive treatment. And then with that invasive treatment, in that also we can focus upon giving the cryotherapy and the other, we can say, manual techniques invasively, which are going to relax the muscles to large extent.
Okay, thank you so much, ma'am. I think we can end the question hour now.
All right. Thank you, everyone.
Yes.
Thank you, Dr. Raina ma'am, and
Thank
thank you
you.
all the participants for joining us. Thank you. Have a nice day.
Yes, thank you so much, ma'am. Before we end the session, I have shared a feedback form in your email ID, the same mail ID. So please, you may give the valuable feedback, and then after that, you will be receiving a certificate through your mail only. So kindly fill the feedback form to receive the certificate, and make sure that your name and your email ID are correct, because in some registered participant, I found that the mail ID is not working. So I was not able to share the meeting link because their email ID was incorrect. So make sure that your email ID is correct so that I can share the certificate after I receive the feedback form. Thank you so much, everyone. We will end the session now. And tomorrow we'll be having another session on nutrition and exercise after COVID. So I'll be sharing the brochure and again the registration link. Every one of you may kindly join again for tomorrow's session also. Thank you, everyone.